We are recording, so you can go at any point.
Hi, my name is Alex Devon, and this is my TED Talk presentation. My thesis research question was, with over 56% of epileptics still having seizures while on seizure medications, why not look at alternative options such as cannabis? Cannabis has shown in patients to have the same success in seizure controls and even some cases complete seizure control, while having much more tolerable side effects. Have you ever wondered why it's so accepted to prescribe children and young adults with medication that contains an extremely addictive form of amphetamine? These medications are commonly called Ritalin, Adderall, and Concerta. Approximately 2.5 million Americans are currently taking these meds. They are totally accepted by doctors, parents, and teachers. They can lead to a lifetime of dependence and addiction. It has the same properties as meth. So I ask, why is cannabis frowned upon? My very personal journey finding what works. Here's a picture of me days before I have my first grand mal seizure. I look really healthy, but my brain was probably firing neurologically like crazy. My thesis was a personal journey. Most of you know I have epilepsy and have struggled to gain seizure controls um, with doctor prescribed medication. Genetics. More testing my epilepsy is most likely genetic, which means there is no direct cause that I have throughout my life, and that my kids have a high chance of also being epileptic. Wait, I just got a little bit lost with what slides I'm on. Sorry. Um, Let me go back to the last slide. Here's where they determined I have GME, juvenile onset of myoclonic epilepsy, through an EEG scan. EEG measures your brain activity. They said on a scale of 1 to 10 of abnormal brain activity, I was a 15. Mm-hmm. Meds. There is no drug that was created to treat epilepsy. Crossover drugs are what doctors use. Drugs that were created to treat bipolar disorder, mood disorders, and nerve pain are what is in the physician's toolbox to treat epilepsies and seizure control. Which is the point of my research. I don't have bipolar disorder or nerve pain, but now I have to take this extremely powerful antipsychotic meds to control my epilepsy. When one drug doesn't work, then on to the next, and then the next, and maybe a cocktail of bipolar, antipsychotic, and antipsychotic, and painkillers. The side effects from taking these drugs are very uncomfortable, especially in kids and their developing brains. Parents and doctors will give them these meds in hopes of seizure control, but at what cost to the individual that has to take them? I am dumbfounded and angry that cannabis has shown epileptics, but there is has shown help epileptics such sorry has shown to help epileptics, but there is such a stigma that surrounds it that it is stopping research and preventing others from benefiting from it. Then these are like the side effects of medication compared to cannabis. Change in mood, vision change, suicidal thoughts, weight gain, rage, aggression, extreme fatigue, depression, fatty liver disease, loss of coordination, severe stomach upset is what the seizure meds um, side effects are. And then the cannabis side effects is memory loss, increased appetite, paranoia, possible dependence, dry mouth, fatigue, and impaired judgment. With over half of the epileptics still having seizures while on anti-seizure medication, why not try an alternative option that is showing success? Cannabis is showing the same results as seizure meds, and even in some cases allowing epileptics to be completely seizure-free. So why has it become so taboo? Cannabis was used to treat diseases since biblical times. In 1000 AD, it was used to treat epileptic specifically. In fact, it was used as the main way to treat seizures, well up to the 19th century. Then it stopped, and marijuana was outlawed. Have you ever wondered why it seems perfectly acceptable to prescribe children, young adults, danger? My slides are mixed up for some reason. Just go.
Yeah.
Okay. Um, why does cannabis seem to work? Cannabis are Cannabinoids are therapeutic, most common, THC and CBD1, 68 other herbal cannabinoids. Um, the leaves and tops of the leaves and flowering tops of cannabis plants produce more than 70 different active herbal cannabinoids. Two most common is THC and CBD. Cannabinoids exist in their um, acidic form in a cannabis plant and are converted to THC and CBD through a process called a I can't heating. This is heating, and this is why it is so important to do this prior to consumption. Other things that are in cannabis plants that have a pharmaceutical actions are called um, terpenes and plantabinoids. These are believed to have broad spectrum of actions such as antioxidant and anti-inflammatory and antibacterial. And then this is just shows where um, the receptors and where it works in the liver and the intestines. And here's a better picture of it. The green area is where it shows where um, the cannabinoids work. And they're all in areas where they can't affect you um, long term. Um, okay, so, the science part of why cannabinoids work is still very misunderstood because of the total lack of research. But just in my very elementary research, it seems to move in a sense of why this plant could be the answer to helping so many other people like me. We naturally have receptors that will coordinate and then receive the helping properties that are in the cannabis plant. Let me go back to the last slide. Charlotte Fiji was a girl who inspired a movement. She had Lennox-Gastaut syndrome. It's the worst type of epilepsy. It's deadly. She had hundreds of seizures a week until the point that at 3 she stopped developing and regressed until her parents researched cannabis. She met these Colorado growers that had a strain called the hippie's disappointment. It was a 30-to-1 ratio, um, 30-to-1 ratio, 30% CBD and 1% THC. Within a week, she was seizure free. She began to walk, talk, and develop again. They renamed the strain in honor of her, called Charlotte's Web. Her type of epilepsy was drug resistant. The doctors tried every drug there was, but all that worked for her was this strain of weed. Um, Charlotte passed away this April 2020 of COVID related symptoms, which is a big risk for epileptics. It might not help every epileptic, but what if it helped you or your child? It can be the difference between life and death, or even a life worth living. And then here's the Children's Hospital. They're in like the most leading research group for cannabis. And then here's some statistics or epilepsy facts, I guess, um, about um, epilepsy. And 1 in every 26 people worldwide um, are affected with epilepsy. About 50,000 people die in the U.S. each year from epilepsy. Just a sense of scale. Um, Here's some statistics about. Um, and here's the biggest or the most updated facts about epilepsy. My action project. My action project was that I created a support group where people and families could come together that are affected by epilepsy. And I know that I feel like nobody, my friends, family, do not understand what it's like to struggle with epilepsy, and especially in the beginning. It would have been really helpful to speak with others and know I wasn't alone. So I created a support group and made this. Um, I forgot what this QR code that takes them directly to the site, and we had stickers made and stuff. Here are some questions that were asked for the group. Do you have an aura before seizures? And what are they? What is your experience with medications? What about alcohol? How do you handle the exhaustion? Do you experience depression? Do you experience anxiety? And do you use cannabis to treat yourself? And those were questions that were asked for other epileptics. My reflection: I've been struggling with epilepsy for years, but through this project, I finally understood the disease better. I've been frustrated a lot, but I see now how complicated it is and that there is hope. I don't feel so alone, and I feel very empowered to help others understand epilepsy and to be a support for those that are struggling to come to terms with this issue. And then here's my works cited. That's it. Thank you.
Stop the recording really quickly. All right, panel, this is our time to ask Alex any questions.